Welcome to Fundamentals Friday, Episode 1. This is a series we'll be doing every Friday to help you prepare for your Hesi Fundamentals Exam. Tune in every Friday for new questions with rationales. A nurse is preparing to administer a subcutaneous injection. Which angle should the nurse use when inserting the needle for this type of injection? 45 degrees, 90 degrees, 30, or 60 degrees? The correct answer is the 45-degree angle. Subcutaneous injections are administered at a 45-degree angle. This angle ensures that the medication is delivered into the subcutaneous tissue just below the skin. When assessing a patient's pain, which scale would the nurse most likely use for the nonverbal patient or a patient with cognitive impairment? Numeric scale, visual analog scale, the Wong-Baker Faces Pain Rating Scale, or the FLAC scale? The correct answer is the FLAC scale. Face, legs, activity, cry, and consolability is commonly used for assessing pain in nonverbal or cognitively impaired patients. A patient is receiving continuous enteral nutrition. What nursing intervention is essential to prevent complications such as aspiration? Elevating the head of the bed to at least 30 degrees, administering medications through the enteral feeding tube, checking residual volumes every 12 hours, or using a small bore feeding tube. Elevating the head of the bed to at least 30 degrees helps prevent aspiration during enteral feedings by promoting proper flow and digestion. Which action is a priority when a nurse discovers a fire in a patient's room? Evacuating all patients from the unit, activating the fire alarm system, using a fire extinguisher to put out the fire, or closing all doors and windows. The priority is to ensure the safety of all individuals in the facility. Activating the fire alarm alerts others and initiates the fire response protocol. A nurse is caring for a patient with heart failure. What dietary restriction is commonly recommended for patients with this condition? A low sodium diet, low potassium diet, low protein diet, or a low fat diet? Patients with heart failure often need to restrict their sodium intake to help manage fluid balance and reduce the risk of exacerbations. Which vital signs should a nurse prioritize when assessing a patient with potential respiratory distress? Blood pressure, heart rate, temperature, or oxygen saturation? Oxygen saturation provides critical information about the patient's respiratory status and oxygenation. In respiratory distress, ensuring adequate oxygen level is the priority. A patient is prescribed a medication with the instruction QID. How often should the nurse administer this medication? Once a day, every other day, 4 times a day, or twice a day? QID stands for quarter in die, which means 4 times a day. When assessing a patient's pain, what is the most reliable indicator? Facial expressions, verbal report, increased heart rate, or elevated blood pressure? The patient's own verbal report of pain is considered the most reliable indicator of pain. What is the primary purpose of the Braden scale in nursing practice? Assessing pain levels, evaluating risk for pressure ulcers, monitoring respiratory status, or measuring cognitive function. The Braden scale is a tool used to assess a patient's risk for developing pressure ulcers based on various factors including sensory perception, moisture, and activity. A patient is prescribed a medication to be given AC in the morning. What does AC stand for? Before meals, after meals, at bedtime, or as needed? AC stands for anti-sebum, which means before meals. These 10 questions cover important concepts you may see in your Hesi Fundamentals exam. Please click subscribe for a new video every Friday and join us every Friday as we go over practice questions to prepare you for your